So we're very pleased to have as a presenter today Diane Billings, who is the Chancellor's Professor Emerita from Indiana University School of Nursing. And prior to her retirement, she was the Associate Dean for Teaching, Learning, and Information Resources, and developed and taught the master's doctoral level teacher education certificate courses. You may recognize Dr. Billings because she has presented several certified nurse education prep courses in Maryland, sponsored by the NSP2. And so without further ado, I'm going to let Diane share her presentation. We're looking forward. Thank you, Diane.
Thank you, Becky, and so nice to be here with everybody. Let's get the slideshow up here for you, and I think I need to make it a big screen. Let me know if you can see it. There we go, and I'm back up just a tad here.
Yes, we
are.
We got you.
Okay, good deal. So welcome everybody. Thank you, Becky, and advisory board team members. This has been great, and I am happy to be back here again in Maryland. I feel like I know quite a few of you that are probably here, and I'm counting on you CNE educators to help achieve the success that this program is all planned to. It's all about being successful. So I live in Indianapolis, and our claim to fame, such as it is we're the racing capital of the world. And this is the Indianapolis 500 racetrack. And in some ways, I think racing is
Dr. Billings, can you please unmute yourself? I'm sorry.
Okay. Can you hear me now?
Yes.
Okay, great, thanks. Okay, well, I'll say my welcome again, and glad to be back in Maryland. And I'll back up the slide here. We're getting started here is like the Indianapolis 500-mile racetrack. So I think we can use this as kind of a metaphor for how we can approach getting ready to do the next gen for the students and the faculty. Okay, now. Okay, so we're talking about getting started, all the good things that we want to do to make a success for the students as they work through learning to do clinical judgments, and we help them do that. So I live in Indianapolis. We're known for our racing, and this kind of seems to me to be a metaphor for how we could think about getting started. And here's a couple of things that are kind of remind me of what we're doing here. First of all, racing is a team sport. And, this is just not intuitively known, because the person who's the race car driver is the one that gets all the credit, and he's the one that gets to be invited to be on Dancing with the Stars. But actually, the whole race is dependent on these guys here that are in the pit crew here. And each one of these has a very special job, and if they are not choreographed beautifully, and actually some of these teams hire the Indianapolis Ballet Company to come and help them so that they aren't stumbling all over themselves. And I think that's what we want to do too, as we're getting prepared to help the students learn about clinical judgment and safe patient care. So we'll talk a little bit more about team sport. But another thing that is true of the Indianapolis 500 is that everybody can cross the finish line. And of course, some people are going to do it earlier than others and make a little bit more money, but everybody has the potential to cross. And that's what I think the goal is for us with this project. We're all about getting everybody ready to cross the finish line. So we're after this session is kind of what the overview of what I'd like to be able to accomplish. And this is what the race car drivers think about when they are getting started with doing their race, is first of all to scope out the track, meaning we're going to get a big picture of what needs to be done here. We're going to talk about assembling the pit crew and their very important role in making the project and the students' work a success. we're going to talk just a little bit about how to choose and use a clinical judgment model or framework, and we'll talk a little bit about that. We're going to hopefully give you some ideas of how to make a master plan. You know, this is kind of what the race car drivers have to do. They have to scope out the track and then plan how they're going to, the strategy for the race. And then we're going to talk about preparing the students to cross the finish line, and everybody's going to end up with the checkered flag. So first of all, what the race cars drivers do as they get started is they take some test runs around the track, and they look to see where the track is uneven, where they're, how fast they can go around those curves, where they're, you know, what kind of strategy they're going to use to be able to be successful and be fast but safe. So as we're getting started, we want to think about, you know, the big picture, where things are going, where you need to shore up some resources, and just, you know, kind of have an overview of where you at your school are going. The next thing you want to think about is getting this pit crew going, and there's a pit crew chief, and I think most of you have identified somebody who's going to be responsible for you know, the whole overview of what's going to be happening at your school. But actually the team also has the team members, and you will need to be able to figure out who's going to be involved. It's going to involve the people that are teaching clinical judgment and teaching the students, and it's also going to be involving the people that are writing the test questions. So it's going to be a whole team here that's going to be involved in helping the students get ready for the next gen. Okay, and we're going to talk a little bit here about getting started with the clinical judgment process. And there's some programs here in session in track 1 that we'll talk a little bit more about using the clinical judgment models. So why are we going to focus on clinical judgment? Well, this is not new information for anybody. We know that our patients are you know, really sick and require some effective judgments, and I've you know, been visiting some of my friends and family members who've been in the hospital, and you can just see how sick the patients are and how important it is for the nurses to make clinical judgments. Because I've watched them and intervened actually on several times when their judgment really wasn't based on accurate data. So another interesting point is just knowing information isn't enough to make good clinical judgments. And you sometimes see that in your students. They know all the answers, but when they come to clinical, they aren't really able to apply it and to think about what all the information that they've gathered means and how they're going to put it to use for the patients. And of course, we're trying to prevent errors. And, you know, we're, as nurse educators, we like to think we're using evidence to make our curriculum decisions and our teaching decisions. And here is the evidence that's driving why we need to help the students make good clinical judgments. And yeah, excuse me. So you've probably looked at this information and, or, you know, read it. So it's not just the fact that the National Council of State Boards of Nursing is now adding some new kinds of test questions that we're trying to do this. It's really, or, you know, really being driven here by some evidence that we need to address and include in our curriculum. And we have a couple of definitions of clinical judgment. You've seen these before many times, I'm sure, but one thing that strikes me, this is the one from the National Council of State Boards of Nursing, and you can see the key words there, but the one word that I like in this definition is observed outcome. And to me, this means we can see what the students are thinking and doing. So we can see it in their behavior, we can see it in their what they talk to us about, we can see it in the judgments they make, we can see it in their written work. So this, to me, gives us a lot of guidance of how we can help the students learn to make good clinical judgments and decision making and do their critical thinking. And this is, you know, in some ways, this is not new for us. We've had learning outcomes pertaining to this and program outcomes for a long time. And those of you that are, you know, rethinking your curriculum, ACN has also put out their definition of clinical judgment. And kind of what I take from this is, you know, the keywords are still there, similar words, is that, you know, our program outcomes, and again, I don't really think this is something new, but it gives us a chance to kind of focus on what the clinical judgment and kind of make sure that we're threading this through the program and through our courses and through our lesson plans and so on. And so if you are in the process of doing curriculum work, you can kind of double dip here and focus on the clinical judgment for the purposes of helping the students right now, but certainly for getting it all embedded in your curriculum. So just some thoughts here about choosing and using a clinical judgment model. And we can talk more in another one of the workshops, but in general, you will want to have just one model. And I've talked to faculty, and sometimes programs have 2 and 3 different frameworks or models that they use. And to me, that's just going to confuse the students. So we want just to have one framework. And once we're getting the students to repeat and repeat and repeat, thinking, using a consistent process across all of the courses, that's what's going to, when they're working with the patients, it's going to, come back in their mind that this is what they need to be thinking about. And we can't expect the students to make good clinical judgments unless we teach them. So that's, really going to be the first step, is where they understand, the framework that you are using. And again, there's many out there from which you can choose, but choose one and then follow that fully. And then another thing about processes, because I think clinical judgment is a process that has steps that need to be followed. So as we're teaching, each of those steps need to be taken. And I think sometimes when we're teaching, we're focused maybe on assessment, and all the information and things that we do are focused on assessment techniques. But what happens next? What do the students do with that data that they're gathering? So that's where trying to get this all into the next steps, even if what we're teaching has to do with one aspect of a step, we need to have the students understand it in the full framework. And actually, I think this, whatever clinical judgment model or framework that you're using will work in all of your courses. Maybe there's a few that are exceptions, but from the big first course, nursing fundamentals or nursing 101 or clinical nursing, whatever those first courses are, students can begin to learn to make clinical judgments. What they don't have is a lot of knowledge. And that's the next point is, the clinical judgments are going to increase in complexity when the students have more knowledge. But just because the students don't have all of that knowledge doesn't mean that they can't, in those first courses, start to think in a clinical judgment model framework way. So sometimes maybe thinking about what you're teaching in your courses to then think about, where is that information embedded? What do you want the students to do with it? In some of those beginning courses, they're learning facts and knowledge, but we really want them to be able to put it in a context so that they can then understand why they need that information and what they're doing with it. In other words, apply it. Okay, so again, as the students go through the curriculum, they will have more information that they can embed. They'll understand the lab values. They'll understand different cues that the patient has, and they'll be able to, and more, knowledge about health problems and so on. So then they can, be advancing, but the same underlying clinical judgment process will prevail. So if we think that we can help the students make good clinical judgments, they're going to improve with practice and feedback. So that kind of gives us a message too about what we need to be doing as faculty members, create opportunities for just practice and for feedback. So just that to me is just kind of the big picture of some things to think about right now about using a clinical judgment model. And so I've made a to-do list for you so that at the end of this session, and when you start thinking about what you're going to need to do as you go through planning here, these are some things that you can think about. So, get that one CJ model selected and look through then how it plays out in all your courses. I was working with a faculty member in a leadership development program, and her project was to get the clinical judgment model embedded in the curriculum, and they were going to use the nursing process as the framework. And as the group started looking at what was going on in the curriculum, they found that nobody was following the same nursing process. nobody was teaching it in the same way. None of the homework assignments or lesson plans and so on actually were following along in the same way. So even though the school subscribed to one model, they were not implementing it all in the same way. So that ended up being what her project was, is to figure out how to get all the faculty on board in one way and harmonize that. So if you're thinking about what model to use, probably one good first step is to figure out how it's being used now, and if you need to tweak it or tweak the implementation a little bit, that would be something to kind of think about. So the good first step, as always, is to assess and see where you are. So then you can see where this falls in your program outcomes, your competencies, your course, and your lesson, and look at your learning outcomes and see that you're guiding the students with some learning outcomes, and then of course evaluating them at the end of their learning. So then you can also take a look and see what kind of learning strategies you're using, and looking a little bit about the assignments that you are giving the students, and see how that all integrates with your model. And then if you need to make any revisions and so on, you can think about that. And then you can also ask yourself, who's going to be responsible? That goes back to that pit crew. We can have the chief, but we need people who are then hands-on in the courses, and that they are known that this is their responsibility to do that. So I think our philosophy here on the task force is that we don't think that faculty need to, invent everything and reinvent a wheel. You're doing most of this work already. Some of it's just going to be able to integrate thinking about clinical judgment and giving the students more opportunity to learn how, and to then also to be evaluated. But think more about integrating. And then I always, when I'm doing any kind of work, I like to think, what other things can I do? And I call that double dipping. And those of you that are doing curriculum work, particularly here around the clinical judgment learning outcome or program outcome that you have, you can shore that up. And if you're going to be writing an accreditation report, your work is already done, because that program outcome is threaded through your curriculum. So, well, those are some things that you can be thinking about as you are starting up your semester. Okay, and then we're going to talk a little bit about teaching, and we have a whole program workshop planned for you for that, and that's all posted up on the website, where you've had information where that website is. So lots of things about how you can integrate clinical judgment into your teaching. But we'll talk here just a little bit about some overview things to kind of think about how you can, and I'm using that word integrate because I'm pretty sure you guys are doing some good teaching, but you can think about how you can do this in your classroom and in your clinical and sim. So that in general, I'm saying this several times, identify who is responsible, because that if somebody isn't noted to be responsible, it's not going to happen. And so everybody who's on the pit crew needs to know what their role is. And then you can look at your course big picture here and look for some opportunities. And in the workshops, the session presenters are going to give some very specific kinds of things that you can do. But now you can be looking, particularly as you're starting up teaching your course, you take a quick look at the big picture. Where is it going, and where are there some opportunities to teach clinical judgment? So, again, start with what you're doing and then adjust. The other thing is, I'm going to say this several times too, you want to make sure that the students have a chance to practice the full process. So even if your course is, focused on implementing skills, for example, we want to make sure that there's things that precede that and provide the context and so on for that to happen. Okay, and so teaching the full process, because if the students aren't doing the full process, they're just thinking in segmented ways, and it's not going to help them in the big picture when they're taking care of patients. And then you can take a look at your assignments and teaching strategies to see how you can understand and prompt for the behavior that we want the students to be demonstrating. And that goes back to that definition. It's the visible outcome, clinical judgment is the visible outcome of a thinking process. So you can, develop your assignments and so on, and make sure that you have a way of seeing that the students are that they are making clinical judgments and doing critical thinking. So don't assume, but make sure that you can see it. Okay, and then here's the to-do list. See where clinical judgment fits within the course. Again, somebody needs to be the point person. And then you can also look at the assignments. We've talked a little bit about teaching strategies, but the students also are, hopefully doing readings and have a textbook, and you want to, see what those assignments are, what the information the assignments are giving the students so that they can use it for clinical judgment. And probably the textbooks right now, unless it's a brand new edition, aren't really focusing on clinical judgment. They probably have information about other kinds of things or similar, but you want to make sure that how it's aligned with how you're teaching. And another place to look and kind of take a reading on how it is anything that you've assigned the students that would be videos or multimedia kinds of experiences. And know that, during the pandemic, faculty have used a lot of, simulated simulated clinical excursions and things like that that they use. But how do those portray something that involves clinical judgment? And some of them that I've looked at are very good about helping the students learn assessment skills, but they are not then taking the next steps of putting them in a context and just figuring out what needs to be done with all that data that they've gathered. So, again, look at your multimedia and see what's there, and other opportunities for enriching it. Okay, and here's some things that you can do in the clinical courses. And again, the big picture here, while you're starting up the course, see what you have there and find out how it's working. And again, and I think maybe particularly with the clinical courses, this is where the clinical judgment actually is observed. So you want to be sure that something is happening that's doing it more or less consistently in each course. Because if each course is asking the students to do things differently, they're going to be confused. So another thing that you can take a look at is the kind of written work that the students are doing. Care plans and concept maps and things like that. It's, often this is part of, the clinical activities, and sometimes it's part of a clinical course grade. So care plans are really kind of an interesting thing, and they, in the past, are usually written in columns. We ask the students to, write, what assessments did they make, what plans did they make, what implementation and evaluation, that would be kind of following the nursing process. But we structure that by putting headings on those columns. And now you could take a look at that and see, do those columns then help the students make clinical judgments? So I look back sometimes on the care plans, and there was an era when we were trying to teach nursing diagnosis. And so that was the column that the faculty paid most attention to. And that's really what then the students had to, pay more attention to that too, because that was a big part of what was graded on that care plan. Then there was a point in time when we were trying to figure out what's independent and dependent nursing care, and we had columns for that. So now I think we're at the point where we can do something about the structure of the kind of writing or written kinds of activities that we have in the care plans, and make sure that they are pointing in some way to clinical judgments, and that those, I visualize these columns, and then each one has a line to the next step. But sometimes that line puts it all in a box instead of having a kind of a linear and a sequential clinical judgment model process being used across it. So just a thought to take a look at, what kind of written work you use in clinical. And pre and post conferences, that's another good opportunity because the students usually talk. So you are making their, finding out what they're thinking when they do that, and can be giving them feedback and leading them through the clinical judgment process. And then kind of going back again to the point that in clinical, all of the faculty need to be on board with understanding how your curriculum and your courses are teaching clinical judgment. And if your school is like mine, we have probably at least 50% of our faculty are part-time, and they only teach clinical. They're really just loosely connected to the school, and this is going to be really important for them to be able to know how to help the students, so that across the board, all of the students are, you know, kind of getting equal attention in terms of how the faculty are helping them learn to do clinical judgment. And then another part of clinical often is the nursing staff and the preceptors that are working for the students. And so you would want to orient them too. So kind of some big picture things to think about what you're doing in your course, and maybe where you need to make some adjustments or tweak or whatever. And then we also use use clinical judgment in the skills courses and simulation. And there's workshops too that are going to give you some ideas of how to do that. So we want to think a little bit about how we're teaching skills in a clinical judgment framework here. And sometimes we're focused just on the skills, the technique of, you know, doing the skills. And I'm, you know, kind of thinking back to skills labs, and the students are checked off on their technique, but we maybe need to be thinking a little bit about how those skills are embedded in clinical judgment. What kind of clinical judgments do the students need to make to do the skill? And sometimes they are gathering in some data about a patient, and maybe doing that particular skill shouldn't be done at that point in time. So we want to make sure that the students know that the skill is embedded in a larger picture than just, you know, doing the skill. So maybe it will involve making some context, you know, having some case scenarios that the student is relating to when they're doing their skills. And, you know, another thing you can do is add data to the teaching of the skills. You know, some drugs, you know, what would you do if the patient is taking this drug, or how would you modify doing the skill for if the patient had X, Y, and Z? So some scenarios. Another thing that some of my colleagues do is, while the students are in the skills lab waiting to be checked off, they have little scenarios for the students to practice. And this is another way to, you know, kind of enrich both the teaching time and then the students' learning time. And the same for Sims. You'll be looking, you know, it can take a look at how you're doing your Sims and what opportunities do you have to embed clinical judgment into that. Okay, so we're going to be thinking too about assessing and evaluating the students. That, you know, comes next, and we have a program track about that, and we're going to have some interesting workshops on how to do that and how to write the test questions and how to you know, think about Sims and some of the technology to deliver the questions. So we full range of information there. So I'm going to just point out here kind of my favorite topic or point to make is to make a difference between, understand the difference between assessment and evaluation. And, you know, assessment is something we do with the students while they're in a learning mode. It occurs after we've been teaching and they've had a chance to learn, but they also then need to have a chance to make sure that they know it and that they can get the feedback. And we need to do this with the students before they go into an evaluation where they're going to be graded. And then assessment occurs, or evaluation occurs after assessment, and, you know, usually involves tests and papers and, you know, checkoffs and things like that, in clinical practice too. But this usually results in grades, and this then ends up to be kind of a high stakes situation for the student, because it makes a difference whether they pass the course or, you know, complete the requirements for graduation. So I'm thinking assessment here, when we're thinking about NextGen NCLEX, is maybe going to be a little more helpful to us than it might otherwise be, because what we want to be able to do with the students is to give them as much time to practice without being graded. So we can give them, you know, activities in the classroom, case studies to do, care plans and things like that, and find out what they're thinking, how they're making those judgments, and then give them, you know, rich and rapid feedback so that they can learn right on the spot without having to be evaluated. And then we are, you can make some judgments yourself, teaching judgments about how many questions or if and how many and what you're going to use in your evaluation. So that's my little soapbox, I guess, about assessment. But I think this is what can be the most powerful way that we can help the students is, to teach and have that next step of assessment, and that we're with them, or they can get feedback, of course, from each other and from themselves. You can make, a case study and then have them do it, and then have them, give them an answer key. So, you can put that on kind of a autopilot if you want to, but the students need some kind of feedback as they're learning. And this is where I think we can maximize this particular part of the teaching learning process. Okay, so now what you can do now, you can look about what's going on in your class and then decide, what else you can do. So, first of all, make an assessment as part of your lesson plan. Plan active time within your class that you give the students a chance to put it all together, and then they can also find out that they've put it together correctly. So sometimes having a bank of case studies, and you can get those developed across the curriculum. Students can help, they can make case studies too, and it's really kind of a quintessential teaching strategy here for clinical judgment is some kind of an unfolding case study. And then you can embed these clinical judgment strategies in a lecture, because you can post up the questions, practice questions, the students can answer. Then you can, for the whole class, you can kind of give some feedback as you're going along. So rich and rapid feedback, and many opportunities for the students to practice, but not be graded. Okay, but then at some point the rubber meets the road, and we do need to come to the evaluation step. So the next thing that you can do now is to look at your tests, and I'm sure many of you are about ready to give your first exam. Take a look at it and see, how it is and what you might need to be doing differently with it. So, look at your questions, and if they need to be revised. The other thing I want to mention about your questions is to make sure that they are all at application level and above, because sometimes we're just checking for knowledge, and we need the students to, part of clinical judgment is to be able to put the facts into a context to make good decisions about patient care. So look and make sure that your questions are, at least testing in some ways. That's the way of testing clinical judgment. And I'm going to skip down to point 3 there, because if you can add context, and I use the word data, you can, have an S-bar, you could have nurses' notes, lab reports, drugs, physician orders, things like that. And that will increase as the students are going through the curriculum. The beginning class, they probably just would know some basic things like, normal vital signs and so on. But if you can, on a test question, add some information from a nurse's notes or history, or, a drug order that the patient is taking, then those questions are automatically bumped up higher, because the students have to integrate the data and apply it. And then they have to make, the question's going to ask them what decisions are they making. And right there, you're introducing a clinical judgment type question. Okay, and then I'm going to, I want to talk about the blueprint here next. And when I teach the C&E reviews, I always ask, how many of you use a blueprint with your students? And I don't, not everybody raises their hands. And I always then go back and say, well, this is, really an important document for both the faculty and the students. And so when you're looking at your test and making, making the blueprint, which is, kind of an organizing framework for what you're testing and how many questions on each topic, take a look at that and see how you would think about putting in some of the new NextGen type of questions. And bear in mind that a case study, and those case studies have 6 questions. So if you are going to be giving a NextGen type question, that's going to take up 6 test items. And if you have 50 item test, that's going to be a pretty chunky chunk. So you're going to need to think through how you're going to do that. And then because that will show up in your blueprint, so the faculty will first see the blueprint and see how this all parses out for the students. But then the next step is to share it with the students. We don't want the students coming into a test and finding out that, 12 of the questions are going to be of a different type than they're used to receiving. So that's, we want to be transparent and communicate with the students here that particularly when it's a test that's going to be graded and count for a grade. And then I think to figure out how you're going to write those NextGen questions, find some templates, and those you can find those on the National Council's website, and the faculty member is going to teach the sessions on writing test items may have some templates you can use as well. Okay, so again, more questions about things to think about here as you're looking at your test. First, again, review. You can add more context to some of the scenarios. That could be a quick fix before you start getting, deep into writing some new questions. Now, I want to mention about writing those new questions so that everybody has the heads up and appreciates. People have found that it takes 15 to 20 hours to write a full case study of 6 questions. So whoever is tapped and has the responsibility for rewriting or writing new test questions, the whole team needs to appreciate what those people are doing, because it's a heavy time commitment to get that all going. So think through how that's going to go, what you're going to where on your test, if in fact you are going to be using them for grading, where they're going to fit. So you can also be thinking about using some of your select all that apply, those dicey questions that students tend to miss often, because now one of the NextGen type questions is has I think 10 or 11 of the options there that the students have to evaluate and choose from. So you can think about that. You can think about expanding the questions that have trend data, and then also people are thinking ahead, how are they going to administer add those questions to a test that's computer administered on a computer test authoring software program. So just thinking about that, and if we don't get quick fixes, I think this is all to be continued here to find out what is going to be, what kind of technology we're going to have accessible. You can be thinking about doing paper and pencil tests for both assessment and evaluation. And I think you can post those up, using a Word document and have the students, answer that. You could also, distribute it some way to the students. And I use that word assessment here in this thought about questions, because that's where I think that the students can get a lot of experience answering these questions and thinking about it, and making sure they know how to use the clinical judgment model in an assessment mode where their grades are not so totally dependent on their ability. That should prepare them enough for the state boards, but to me, this is something that is more easily done and less risky for the students. So that's my opinion. I don't know if everybody would share it, and it's up. These are judgments that faculty make, so you can decide how you want to handle that. Okay, so again, here's some more things to be thinking about now as you're getting ready, and make a plan, because the workshops are going to help you implement, give you ideas to how to implement a plan, but you're wanting to think about it right now. So saying it again, look at your blueprint and be sure that you're sharing it with the students. I am so concerned about having students see and have do the NextGen type questions without having enough practice, because if it's a graded test and they have not seen these kind of questions, they're really at risk. And then another thing that's going to happen here is you're going to need to figure out if you are using the questions to grade as a grade, what faculty should do is have a post-test review. This is just a good practice anyway, and everybody, all the faculty get together and look at, the data that comes back from your item analysis, and then decide how you're going to handle if everybody has missed a question before you distribute the test to the students. So you want to make sure that you have a good protocol in place for the post-test review for the faculty, and then also a post-exam review for the students with lots and lots of feedback, because the students need to know, be able to figure out what they did wrong, and they probably need a faculty member to be there to help them figure that out. You can, do that. I have a colleague who does a post-exam review with every student in her course. She has 30 students, and she invites each one of them into her classroom, her office, to go over each of the tests. That, to me, that's a labor of love and very time consuming. But there's other ways that you can do that too. But the students do need to see, where they miss the questions and what they can, how they can do better, figure out a different way of answering the question or understand what the question is asking. So that, again, is something that you can be doing now as you're thinking about what you need to do. And then here you also want to be thinking about using the test administration software. And right now, my understanding is that there's not a lot of it easily available, and probably some of the software that you're using right now, it doesn't have the capabilities for administering the kinds of questions that are going to be, the NextGen questions. So figure that out. Look at how you're going to score, what the impact of it's going to be on anything that you do. And then right now, I would say, think about some workarounds, because I would not want or think it's a good idea to wait until some software comes along before the students can do something with these questions. So to me, paper, pencil, I use that meaning like a Word document that the students can have with the questions on it. And again, some of those templates are available, for how to lay out the case study, how to lay out the questions, and so on. So there will be sessions on that topic, but again, in terms of thinking about how you're going to handle this, these are questions that should come up in course meetings. Okay, and then also you're going to be needing to think about what you're doing for clinical evaluation. So those of you that are teaching clinical now and are responsible for faculty that are teaching clinical, you want to look at your course competencies, course outcomes, and so on, and see where clinical judgment fits, and make sure that you're aligning. If you're going to be evaluating if the students can make good clinical judgments, you want to be sure that the objective and the evaluation all are lined up. And I imagine many of you are still using those checklists and rubrics and so on, kind of for formative evaluation. You want to make sure that that's all lined up. If you need to tweak it, to be sure to think about doing that. And then clinical has always been kind of a conundrum for me too, because most of clinical teaching, at least in the first weeks of it, is where the students are still learning and you're giving them feedback. And then there comes the point where we're evaluating and putting a grade to it. But we often don't design the courses in a way that the students and us too can distinguish when are we teaching and when are we evaluating. So take a look at that too, because we want to be able to give a lot of feedback to the students, and tell them we're asking, these are teaching questions, not evaluation questions, so that they understand that we're just trying to help them think and make good judgments. So again, align everything together, the evaluation instruments and your course competencies, and how you're going to integrate the emphasis now that is being added here with the clinical judgment. Okay, so we're ready to take the final lap, because we've been around that track 499 times. It probably is going to feel like that by the time the end of this semester and going forward comes. But there's a few more things here, because we want to make sure that everybody's still in the race, and we want to make sure that there's no accidents here, because you can see there's a chance for a lot of pileup here at the end. So we want to take a few more things, think about a few more things before we take the final lap, or as we're taking it. So we want to, kind of a review here. The faculty need to be on board. So what we've just talked about is all the things that you can think about in a plan, and somebody's been named the pit captain, or the the person responsible overall for everything. But we need to make sure that the crew are there and that everybody's ready at the starting line, because as it is in the race, it's this pit crew that makes the difference of winning or losing. So you want your team, your pit crew, all lined up and ready to go here, and well prepared to work quickly and not stumble and bumble over each other. And that's why the race drivers hire those ballet dancers to come in and help them choreograph. You can also go to the National Council Conference, which is this September 30th. It's virtual, so I imagine it will be could be easy to attend. Sign up for the National Council's NextGen newsletters. Those are ever so helpful. And I just got an email today, many of you did too, if you're on their mailing list, that they have now, National Council has a website where they have a lot of resources posted. And those are really good. They have good videos about the test items. They have examples of the test questions. They may start having some things about teaching, because we know that we have to teach before we can test. And then for sure, you're going to participate in the upcoming sessions here for this program. Okay, and then another part of this final lap, because we're down here to the home stretch, looking for that checkered flag. We want to have the students be prepared. So, I think I've said throughout here, we need the students to know how to take these questions, and we need to have them practice. They have to, take those questions, or write the care plans and so on, and get the feedback, because that's how they're going to learn. And we can teach the students how to, I've used the word parse, how to understand what the question's asking and how to respond, because there's kind of some new strategies there that the students can use. And then, there's so many resources for students, and we know that more practice questions and more practice, we get better pass rates. And, we'll have pass rates in your courses, and the pass rates, maybe some of the programs that you use that give them some predictions about pass rate. And then certainly we want the pass rate 100% of all the schools in Maryland with high pass rates. Okay, so you're going to get the checkered flag. This is kind of the summary of what we've been talking about. So you're going to get an overview. This is what the race car drivers do, and this makes sense. It's kind of, I think it's a metaphor for how we can move forward here. So scope out the track. That's the first step. Get an overview of what's going on at your school. Assemble the pit crew. These are going to be the key people that are implementing all of this. They're the hands-on faculty members that are in the courses. So make sure that they understand they're part of a pit crew, and actually the pit captain can pull them together every now and then to make sure that the plan is going as desired. So that's really important. We're going to, for sure now, within, soon, make a decision about the model framework that you're going to be using, and then make sure that it follows through in all the courses. And then you're going to be thinking about the teaching and assessment and evaluation, and that's what these workshops are all about. So you want to be attending those, because they're going to be chock full of good ideas of how to do all this. And then, you want to be sure that both the faculty and your students are on board here. So you're going to receive the checkered flag, and you want to make sure that you come to our workshops and hear some thoughts about getting ready to do that. First of all the sessions are going to be recorded, so you can look at them at your convenience. I'm wondering if it's a good idea here to have the pit crew chief and the pit crew attend some of these sessions together, so that everybody hears it and can be thinking about it in terms of what goes on at your school. Because we're now at the point where you've heard a lot of information here today from other speakers that have been working with your faculty and so on. So you want to make sure that now you've learned and heard, and now the next step is to do. So when you come to the sessions, bring some work that you're working on, some drafts of test questions, drafts of teaching strategies, and then use that opportunity to refine them and to talk to the faculty member who's teaching them, get some ideas and so on. And then have in mind that you're going to leave here with something that you can use, a lesson plan or test item or teaching strategies or something like that. So I'm visualizing for all of you that you see checkered flags in your future and that everybody is going to cross the finish line. So a couple of pages of references and resources, and then I'm going to thank you for listening, and we'll have designated times for questions and answers. So I'm wishing you the very best and success. So Becky, I'll turn it back over to you.
Thank you, Diane. Appreciate that. Lots to think about here. I see there are some questions in chat. Heather, did you want to address a couple of them to Diane? We have a session for break, and it's kind of a question and answer. You can all take a break, of course, if you want, or you can stay and listen to some of the questions.
Sure. So I did answer one of the questions in chat because I was able to get the information from National Council. So if you want to look in there, so it was asked the cognitive domains, Bloom's taxonomy, how much should be on each exam. So I did put a link to the RN test blueprint. Page 4, it does say majority of the items are written in the application or higher level cognitive ability. So that's straight from the National Council. So, you know, that's what their exams look like. So yours should be very similar to that. But for Diane, some of the other questions that were, what is the thinking about teaching nursing diagnoses? Should we continue to teach them?
Well, what I can say about that is that they are not asked on the licensing exam. The students do not need to generate a very specific NANDA-type nursing diagnosis, but they do need to understand the nursing problem, and they need to be able to see cues or assessment data and make a judgment, a hypothesis, or a diagnosis about what's going on with the patient. So I don't think there's anything wrong with teaching nursing diagnosis, particularly if you want to follow NANDA and you want to follow the nursing process in its purest form, I guess I'll say. But then there's nothing wrong either about being more general, just, you know, saying the patient has, you know, difficulty breathing or you know, oxygen deficit or something like that. That's maybe not so specific in nursing diagnosis language. That's how I would say that. And again, it should be consistent across the courses. If you are going to ask the students to make nursing diagnosis, all courses should do it. And then I would say nursing diagnosis is just one step, and to spend a lot of time on one step and not go all the way through the process. So they need to understand that the diagnosis comes from doing some assessment or cues, and that they have gathered data that leads to that. And then they need to understand what they're going to do next with it and confirm that the right diagnosis has been made, and then make the plans for implementation and taking action.
Thank you. So one of the other questions I think I answered partially is, what are some of the clinical judgment models you think work well and why? And what does the suggested model include that's better than some of the other models? My response was, we're not here really to suggest one model over the other, just to show you what's out there.
Right.
But Diane, maybe you have something else to add to that as far as what works well and why.
Yeah. I'll say that I'm going to be the one that does the next session, and I'll talk specifically about clinical judgment models and a little bit about the pros and cons. So Heather, as you pointed out, it's really up to each school what's going to work best. And if they're using one now, probably, and if it's well integrated throughout the curriculum, that may be the easiest approach to go. But the whole point of any of these models is to help the students have a systematic thinking process for making judgments, and how to link information, you know, data and cues and assessment to action and evaluation. So it's not just an isolated thing. But then we'll talk about how to use a model throughout, you know, how to use it.
Whichever model they choose. So,
yeah, exactly.
Excellent.
Yeah.
So there's just two other questions. One was, what is the rationale for implementing paper and pencil tests for assessment and evaluation, considering NextGen is computer-based?
Yeah. Well, I agree. Putting it in the computer would be the best way to do it. But right now, my understanding is that there is not an easy way for the kinds of tools that you currently have for your tests, that are embedded in a learning management system. And if there's products out there that mimic exactly what's going on for the state board's questions, I would say get hold of those. But you can design them in a paper and pencil way that replicates it. It's just that it's not going to be deployed on the computer. But then too, on the National Council's site, they will have the tutorial like they always do. And the students should see that. If anything comes across your desk that the students, give students an opportunity to do digital test taking, take it on online format, by all means, grab that. I'm just, if you're wanting to start now and it's not available, we can go ahead and do something with paper and pencil. And the students will see the same questions in the same format, but they won't be punching the buttons.
Great, thank you. And there was just one other question. Are there any orientation models for preceptors that you're aware of that can serve as an exemplar?
Well, there are orientation models for preceptors out there. Some of them are online. Some of them are, packaged up, and some of them probably, I think, are commercial. I haven't looked at any of them to know what's in there about teaching clinical judgment. So, there's a entrepreneurial idea for somebody.
Great. Okay, I think for now, and there are some people that are commenting in the chat that as far as the paper and pencil versus online, and ExamSoft is certainly looking at options for testing NextGen. So if people have the ability for that for their students, people are suggesting that, as well as Soft Chalk. There are apps like H5P that can help replicate the exam templates as well. So there are some online things out there. That all comes down to budget. So I think, like Diane mentioned, if you have to go back to paper and pencil for those new NextGen just to get them, acclimated to them, that might be a way to do that, but not certainly recommending that we go backwards for all of our exam testing, just simply to familiarize our students with the new NextGen type questions.
And we do have a session, probably more toward the end. Rita and Chris are teaching that, and we'll give the latest information at that point. I'm thinking something's going to come out here, breaking news, in another couple of months. But in the meantime, don't wait. Have something that the students can do.
Yeah. Great. All right. I think that was all we had for questions in chat up until now. So that's great. I think we've answered everything. Please keep the questions coming in chat. I'll be monitoring them as we go through, and then we'll be answering them. If I can answer it in chat like the NextGen, I will, but otherwise we'll wait till question and answer at the end and see what we have time for.